Hey YouTube, welcome to another video from SkinnyMedic. In this video I want to talk about first aid kits. Now first aid kits are a dime a dozen. You can search YouTube and find hundreds if not thousands of videos on first aid kits. But I wanted to show you my personal one. This is the one I pulled out of my truck. This is the one I use. And like I said, first aid kits are a dime a dozen. Everybody's got their own opinion on what a first aid kit should include. So I want you to take this information that I provide you this video and build your own. Go to Walmart, get on the internet, buy you one, build pieces, whatever you choose to do, but get you a first aid kit, open the seal up, and learn how to use it. That's the number one thing I want to press in this video, is don't just buy a first aid kit, stick it on the shelf, and never use it. I want you to get a first aid kit, open the things up, see what they look like, know how to use it. You know, when the crap hits the fan, WORL situation, you don't want to be figuring out how to use your first aid supplies, how to stop bleeding if you've never done so. With that being said, I encourage you to take a first aid class. You know, they offer classes from even 4 hours to 8 hours up to 2 years. 2 years, of course, being an RA and a paramedic. But they offer classes. Take a class. Get familiar with being first aid. The first thing I want to talk about is get a bag. I like a bright orange bag. Okay, look, I have enough black and OD green bags. Get something that's nice and bright, something that's orange, something that they can determine this is a medical kit. The reason why I say that is because when you need it, you say, hey, go get me my green bag. Well, if you go get my green bag out of my truck, you're going to get a 1911. So that may not be the right equipment for the situation. But if I tell you to get my orange bag out of my truck, you automatically can see this is my orange bag, and you know this is my first aid kit. So get something a little different color. I know we like our OD green, we like our black, but in this case, get something that's bright colored. I like this particular bag just because it has dividers, has different pockets that you can keep everything somewhat organized. This one's a little disorganized because I was using it at the conference, but it has different compartments, different boxes that you can keep everything, to keep everything organized. That way you know where to grab your equipment. This one also has a compartment here that keep a little more advanced equipment in. So have lots and lots of gloves. These are latex free, so you don't have to worry about allergies. You know, some people just keep one pair of gloves. I keep multiple pair. That way you can hand a pair of gloves to a friend, say, here, put these on, I need some help. So disposable gloves, keep plenty on hand, and keep plenty in stock. I always keep a pair of scissors in my bag. You know, I carry a knife as an everyday carry, but when you're trying to cut a piece of someone's clothing off or trying to cut something close to their skin, you really don't want to be dealing with a very sharp knife. So these are a pair of EMT scissors. You can see they have a nice rounded tip on here, so you can cut and it runs along the skin, so you don't have to worry about cutting your patient. I have plenty of bandages ranging from 5x9s to 4x4s. These are from moderate bleeding all the way up to severe bleeding. Just open them up and keep stacking them on top of each other. Don't remove them. Just keep packing them until the bleeding stops. Also, another thing is keep some Band-Aids. You know, these are for moderate to severe bleeding, but for most part what you're going to be dealing with is someone who has a cut finger, just something very minor, and they just need a Band-Aid. So I keep Band-Aids in stock as well. Another thing that I keep in my bag is triangle bandages. These are just pieces of cloth that of course form a triangle. They come with 2 safety pins. You really don't need the safety pins. But these make great swing and swab for shoulder, elbow, arm injuries. You can also use them to secure splints. If you're trying to make a homemade splint, they can do that very well. I keep a couple of rolls of cling in my bag just to secure the bandaging. If you're putting those 4x4s, those 5x9s on something, these can help hold pressure, help hold the bandaging in place. Another good item to keep in your first aid bag, surprisingly enough, is a roll of duct tape. If you're making a splint, trying to secure someone down to a backboard, this works absolutely wonderful, works great. So besides your medical tape, your 1-inch medical tape, you can keep this in your bag. Works well for making a splint. Now for the more advanced bleeding, this is life-threatening, okay? This is if you don't get the bleeding stopped, you are going to die or your patient's going to die. I keep a cat tourniquet with me here. This is some pressure dressing. You can wrap it, it's like a constricting band, works good. And I also keep some quick clot with me. Like I said, these are for life-threatening. If you don't put this on, then you're afraid that that patient or you may die. I always keep a couple of hot packs and a couple of different cold packs. Your cold packs, of course, can be used for your fractures, your injuries that you can put on to help numb the pain, some pain relief, and the hot packs for your hypothermic patients to help keep them warm. They're very easy, just break them open and they're there. So keep a couple of these around in your bag as well. Now, some of the more advanced things that I keep in my bag, I keep an IV set up. That way I can start fluid on myself or my family. Different, just normal saline. This is 1000 cc, my drip set, some IV start kits, and of course different size catheters. This isn't an advanced skill. This is something that you need to practice. This isn't something that you can just pick up and start doing automatically. So this isn't something that, I encourage you to practice, to learn, take a class on. I have a couple size sutures here that I keep with me. I keep them also in my hiking bag. Sutures are one of those things that you've got to know when to use them, okay? You don't want to have to suture every little thing. Everything doesn't need to be sutured, but it's just nice to have on hand to know when you're going to need it, that it's there. I also keep a few different medications with me. I keep some aspirin, I keep Benadryl, I keep ibuprofen with me. All usually about an adult dose. You guys, this is my version of the first aid bag. Is this the perfect first aid kit? No, absolutely not. Everybody has their opinion. This probably isn't the perfect one. There's some stuff I would like to add to it, some stuff I'd probably take away from it. But this is somewhere to get you started and get you some ideas. My perfect idea of a first aid kit's a $200,000 ambulance riding around. So it has everything I need. It has everything that I ever want in it. So, this is just an idea to get you started. Just as a side note for my other paramedic friends that are watching, I also keep a nice 14 gauge needle. I never know when you need to pull or decompress somebody. I hope this video helps you. I hope it gives you some ideas on getting your first aid kit together. If you already have one together, great. Keep adding to it, keep stockpiling those supplies, and get into some first aid classes. You never know when you're going to be the first responder.